If you've ever left a medical appointment thinking, "I wish I had asked more questions," or "I didn't realize that's what the doctor meant," you are not alone. In fact, one of the most common problems in healthcare today is not a lack of technology, not a lack of tests, and not even a lack of expertise. It is a gap in assumptions. Doctors often assume patients understand far more than they actually do. Patients often assume doctors will explain everything that matters. Both assumptions are usually wrong, and the result is confusion, anxiety, poor decisions, and sometimes regret. This article is about that gap, what doctors commonly assume you already know, why those assumptions exist, and how understanding them can dramatically improve the quality of your medical decisions and conversations. This is education, not medical advice. The goal is not to criticize doctors or blame patients, but to illuminate how the system actually works so you can navigate it more clearly and confidently. A doctor's inside view of hidden assumptions. 1. Doctors assume you understand medical uncertainty. One of the first and most important assumptions doctors make is that patients understand how uncertain medicine can be. From the patient's perspective, medical science often appears precise and definitive. Tests give numbers. Scans produce images. Guidelines recommend actions. From inside the profession, however, medicine is fundamentally probabilistic. Most diagnoses are not binary yes or no conclusions. Most treatments do not guarantee outcomes. Most recommendations involve balancing risk, benefit, and uncertainty. Doctors live in this uncertainty every day. Over time, they become comfortable with it. They learn to think in ranges, likelihoods, and conditional plans. Patients, however, often encounter this uncertainty only when something is wrong. And when fear is present, uncertainty feels intolerable. Because doctors are used to uncertainty, they may mention it briefly without emphasis. Use phrases like likely, probably, or we think, or move past uncertainty quickly to discuss next steps. What doctors may not realize is that for patients, those few words may be the most important part of the conversation. When uncertainty is not clearly explained, patients may interpret it as incompetence, lack of confidence, or withholding information. In reality, uncertainty is often the most honest part of medicine. 2. Doctors assume you understand basic medical vocabulary. Medical language is efficient for doctors. It is not designed for clarity. Words like benign, positive, negative, stable, mild, significant, normal for age, have very specific meanings in clinical contexts that often differ from everyday language. For example, a positive test result is not good news. A condition described as mild may still be life-altering. Normal does not always mean healthy, only common. Doctors use this language thousands of times a year. Patients may hear it once in a moment of stress. Because doctors are immersed in this vocabulary, they may not realize when they've switched into technical shorthand. They may assume patients will ask if something is unclear. Many patients do not ask, not because they understand, but because they don't want to seem uninformed, they don't know what they don't understand, or they feel rushed. This silent misunderstanding is one of the most common sources of confusion in healthcare. 3. Doctors assume you know the goal of the appointment. From the doctor's perspective, most appointments have a clear primary goal. Confirm a diagnosis, review test results, adjust treatment, or decide next steps. Patients, however, often arrive with different goals: reassurance, understanding, emotional support, or simply someone to say, "This is manageable." When goals are not aligned, conversations feel unsatisfying even if the medical content is accurate. For example, a doctor may focus on ruling out serious disease. A patient may want to understand how symptoms will affect daily life. Doctors may assume patients understand the scope and limits of a single visit. Patients may assume everything important will be addressed. This mismatch can leave patients feeling unheard and doctors feeling frustrated. 4. Doctors assume you understand trade-offs. Every meaningful medical decision involves trade-offs. These trade-offs may include symptom relief versus side effects, short-term benefit versus long-term impact, certainty versus flexibility, intervention versus observation. Doctors think in trade-offs constantly. It becomes second nature. Patients, however, often experience decisions emotionally. Fear of missing something, fear of regret, fear of choosing wrong. When trade-offs are not explicitly discussed, patients may believe there is a right choice and a wrong choice rather than multiple reasonable options with different consequences. Doctors may assume patients recognize this complexity. Patients may assume doctors are steering them toward the best option. Without clear discussion, both leave the conversation with different understandings. 5. Doctors assume you know that guidelines are not rules. Clinical guidelines are essential tools in modern medicine. They summarize evidence, standardize care, and improve safety. But guidelines are not rigid instructions. They are frameworks designed for populations, not individuals. Doctors are trained to adapt guidelines to the person in front of them, consider factors not captured in studies, and individualize recommendations. Patients, however, often encounter guidelines online as definitive statements. You should do X. Doctors recommend Y. When a doctor deviates from what a patient read online, confusion arises. Doctors may assume patients understand that guidelines are flexible. Patients may assume deviation means error, or worse, negligence. In reality, thoughtful deviation is often a sign of good clinical judgment. 6. Doctors assume you understand time horizons. Medicine operates on multiple timescales: immediate risk, short-term outcomes, long-term consequences. Doctors are trained to think longitudinally. They consider what a decision today means in 5, 10, or 20 years. Patients may be focused on immediate relief, near-term anxiety, or getting through the next few weeks. When doctors discuss long-term outcomes without connecting them to what patients care about now, the information may feel abstract or irrelevant. Doctors may assume patients understand the importance of future planning. Patients may assume the doctor is minimizing current suffering. Both perspectives are valid, but they must be made explicit. 7. Doctors assume you understand that silence doesn't mean certainty. In medicine, silence often means things are stable, there is no new information, or nothing urgent has changed. Patients may interpret silence as neglect, lack of concern, or something being hidden. Doctors may assume patients understand that no news is often good news. Patients may assume the worst. This mismatch can generate unnecessary anxiety. Clear communication about what silence means and when to expect updates can dramatically reduce stress. 8. Doctors assume you will speak up if something matters. One of the most dangerous assumptions in healthcare is that patients will always speak up when something is important. Doctors may assume patients will mention symptoms that bother them. Patients will say if they don't understand. Patients will express their priorities clearly. In reality, patients often filter themselves. They may avoid mentioning symptoms they think are minor, concerns they think are unrelated, fears they think sound irrational. Doctors can only respond to what they know. When patients hold back, decisions are made with incomplete information. 9. Why these assumptions exist and why they persist. These assumptions are not the result of arrogance or indifference. They arise from time pressure, system constraints, training environments, and repeated exposure to similar situations. Doctors are trained to manage complexity efficiently, prioritize safety, and focus on what is most clinically relevant. Over time, this efficiency can unintentionally create blind spots. Patients, meanwhile, enter the system infrequently and under stress. The mismatch is structural, not personal. 10. How these assumptions affect decision quality. When assumptions go unexamined, patients feel confused or dismissed. Doctors feel misunderstood. Decisions feel rushed or unclear. This increases the risk of poor adherence, regret, dissatisfaction, and erosion of trust. Good medical decisions depend not only on evidence, but on shared understanding. 11. How to bridge the gap. Practical strategies for patients. You do not need medical training to improve medical conversations. 3 simple strategies can make a profound difference. First, make your goal explicit. Start appointments with what matters most to you. Second, ask for clarification of uncertainty. Invite honesty by asking what is known and what is not. Third, reflect back what you heard. This confirms understanding and reveals misalignment early. These steps shift the conversation from assumption-based to collaboration-based. 12. A doctor's perspective. What we wish patients knew. Most doctors want patients to feel informed, decisions to align with values, and outcomes to make sense in real life. What we wish patients knew is not more medical facts, but how medicine thinks. When patients understand the process, confusion decreases, even when answers are imperfect. Clarity doesn't come from knowing everything. Let me leave you with this. Confusion in medicine is not a sign of failure. It is a signal that assumptions are operating silently. When assumptions are made visible, conversations improve. When conversations improve, decisions improve. And when decisions improve, outcomes both medical and emotional often follow. The goal is not to eliminate uncertainty or complexity. The goal is to navigate them together. If you understand what doctors assume you already know, you can ask better questions, make better decisions, and feel more confident even when the path forward is not perfectly clear. If this article helped you understand the hidden assumptions behind medical conversations, consider subscribing to this channel. Here, we focus on clarity, not fear, understanding, not pressure, and thoughtful decision-making, one conversation at a time. This content is for educational purposes only and does not provide medical advice. It is not intended to diagnose, treat, cure, or prevent any disease. Always consult a qualified healthcare professional regarding your individual medical situation.
Thanks for watching. Stay informed, stay calm. Subscribe for calm, evidence-based health here on Nourish Today.